One doctor is urging people not to give up on taking coronavirus precautions because he's concerned about the effects of long COVID. Dr. Ezekiel Emanuel wrote an op-ed for the Washington Post titled, "Stop Dismissing the Risk of Long COVID." And Dr. Emanuel is here to talk more about this. He is the Vice Provost of Global Initiatives at the University of Pennsylvania, and he's also served on the COVID-19 Advisory Board for the Biden-Harris transition team. Thank you so much for joining us. I want to start with a basic definition of long COVID, because for a very long time, it's been this sort of vague concept to many of us who don't have it. Does it last a month? Does it last a year? Do you have to have, symptoms 6 months after contracting COVID? How would you define long COVID?
Well, it's not me. It has to be a consensus in the medical community. But in general, it's having some collection of symptoms, things like fatigue, brain fog, shortness of breath upon minimal exertion, dizziness, headaches, diarrhea, that last beginning 4 weeks after your acute infection. It could be, some people draw the line at 12 weeks, 3 months. But it is something prolonged, months after you've had your acute infection, which goes on and does not easily abate. And and you didn't have those symptoms before. That's the key element. So you have an acute infection 4 weeks or 12 weeks later, you're persistent having these serious side effects.
So I know now we're, more than 2 years into this pandemic. We didn't have a lot of data before, say a year ago, on what long COVID was and how many people had it. I'm presuming.
Well, let me correct you.
Okay.
This was first described in May 2020. 2 months afterwards, people who in the initial burst and surge began still having symptoms, still feeling fatigue, brain fog. So it's been around for 2 full years now.
So what I meant was, now that it's been around for 2 full years, I presume there's more data about it. We have a better idea of just how many people, either numbers or percentage-wise, are suffering from long COVID, or do we?
You would think that's true. We should have the data. We should be doing the studies, but we haven't. Right now, we have estimates of anywhere between 3% and 30% of the population who gets COVID might have long COVID. Well, when you have that big a gap, 10-fold differences, we don't know anything. And that is a serious problem. Not only don't we know exactly how many people get it, we do know that vaccines protect. How much is in disagreement. We actually don't know of any therapies, and we really haven't had a systematic effort to test potential therapies that might stop long COVID. We really haven't done the research, and that's a terrible, terrible blemish on the NIH and others.
Yeah, Doctor, why is that? If you say we had an idea that this long COVID existed 2 months into the pandemic, why isn't the research being done?
Well, all I can guess is, as you say, it's been a little squishy to define it, and therefore hard to get the exact right population. And second of all, we just haven't prioritized it. We haven't thought it that important. Getting vaccines out to people more important. Getting a antiviral treatment like Paxlovid, very important. But I think this is a mistake, because if you got vaccinated and boosted, and say you have an acute infection with COVID and it's a cold or a flu-like symptom, that would be fine. Then we'd all go back to normal. But with this long COVID, the chance that even if you have a mild condition, you might end up with long-term brain fog or long-term shortness of breath or fatigue, not really feeling like you want to get out of bed, that changes the equation dramatically, it seems to me, for getting COVID and for wanting to protect yourself from COVID. So I think it's very vital we get answers to these questions, and answers ASAP.
So you're saying if you happen to be one of those people who are vaccinated and boosted, you get COVID anyways, it's probably, what they tell us, this is going to be mild if you've taken those precautions. Most likely, you still run the risk of getting long COVID, even if you've had a mild experience with the actual virus?
Yes. So the best study that I've seen, and again, none of these studies are terrific, but the best study suggests that if you aren't vaccinated and boosted, your chance of getting long COVID may be something like 17%, 17 out of 100 people. On the other hand, if you are vaccinated and boosted, your chances are 3 in 100 or 1 in 33. that's still a pretty high percentage when you compare the risks of brain fog and fatigue and really dramatically ruining your life.
Yeah.
And so I think that's the thing that we really need to concentrate on in terms of very rapidly finding out what that risk really is and finding therapies to that problem. And I think, trying things like immune modulators, antivirals, other things that have suggested they might be useful would be at the top of my research priority list.
So in the meantime, your message to the rest of us is these COVID precautions, masking up and keeping, socially distancing. I don't know. What are the sort of COVID precautions that you say we probably need to hang on to for a while?
Well, I just flew back from San Francisco to Washington, D.C. last night. I wore an N95 mask the whole way, and I did not take it off. I did not eat the dinner. It's a 4.5-hour flight, roughly. Is that a small sacrifice for protecting yourself? Absolutely. Also, I would recommend people, when they're going to be in a crowd indoors, have a HEPA filter running. HEPA filters are readily available now. They clean the air. They exchange the air 5-6 times an hour, and they're shown to protect and take coronavirus out of the air. That's a second thing we should do. And by the way, my recommendation is we should have those HEPA filters in every classroom in the country to protect children, in daycare centers and childcare centers, and in public buildings. My department at the University of Pennsylvania, we've got HEPA filters running when people are in their offices for exactly this reason.
Wow, that's fascinating. Dr. Ezekiel Emanuel, thank you very much. By the way, you're my neighbor. I live in that neighborhood. Thank you very much.
Thank you. Take care.